Okay, so to identify where there might be imbalances in the hip and different leg lengths, I usually ask my patient to lay on my couch, and once I make sure that they're aligned and nice and straight. What I'm actually going to do is going to lift the legs up, and with my thumbs on the bottom of my heel, I'm actually then going to judge whether my thumbs are level. Now, looking at Ruth, my able assistant, I can actually see that she has got a 3 or 4 mil leg length difference, which probably is actually false because I fancy her right hip has been levered out. Now, to correct this, the process is quite simple. How we adjust bones with Dorn Method is we stabilise the limb or the trunk, we introduce movement, and we exert pressure with the flat of our hand or our thumb. Okay, and that's what I'm going to do with Ruth's leg. So I'm stabilising her leg with my arm. With the flat of my hand, I'm going to exert some pressure right at the top of her femur, and that's pressure inwards and upwards into her pelvis. And when that pressure's on, I'm just going to lower her leg. And like this, I can encourage the head of her femur to fully engage back into her hip joint. And I'm going to do this probably about 8 or 9 times. Is that okay? No pain? No discomfort? Cool. And one more. And then once we've done that, we go back and we recheck. And sure enough, that has now corrected Ruth's leg length difference. Now, 3 or 4 millimeters doesn't actually sound a lot, but that's enough to cause her pelvis not to be horizontal and balanced, which could then, over time, lead to other problems developing. Now, the next process, I always do both legs to ensure that that leg is also seated where it should be.